Hi, I'm Dr. Paul Paddle, ear, nose and throat surgeon at the Melbourne ENT Group. In this explainer video, I'm going to talk about a very common ENT condition, allergic rhinitis, often referred to as hay fever. I'll describe the condition, including symptoms, investigations, and treatment options. Allergic rhinitis is caused by the nose coming into contact with small airborne particles called environmental allergens, such as grass pollens, when it is known as hay fever, tree pollens, house dust mites, animal hair, and molds. Allergic rhinitis affects around 1 in 5 people in Australia. It can begin at any age, though most people first develop symptoms in childhood or young adulthood. Children less than 2 rarely have allergic rhinitis symptoms, and adults rarely develop allergic rhinitis symptoms for the first time, without having had some symptoms as kids. The symptoms and signs of allergic rhinitis include nasal symptoms such as a runny and congested nose, an itchy nose, postnasal drip, sometimes facial pressure and/or pain. Eye symptoms such as itchy eyes, watery red eyes, and swelling and blueness of the skin around the eyes. Throat symptoms such as a sore and itchy throat, a hoarse or altered voice. And lastly, ear symptoms such as congestion or a popping sensation of the ears, and sometimes itchy ears. Symptoms of allergic rhinitis may vary with factors such as age, season of the year, and other environmental exposures. Symptoms may be mild to severe. Mild symptoms do not affect day-to-day function, whereas moderate or severe symptoms can. Patients may experience periods when they have no symptoms at all. Symptoms may be seasonal or all year. Symptoms may occur in a particular season, usually due to grass, weed, or tree pollens, or they're persistent throughout the year, usually caused by allergies to house dust mites, moles, or animal hairs. Symptoms can be related to age. Symptoms are often at their worst in children older than 2 and in people in their 30s and 40s. As we age, symptoms usually become gradually less severe. Symptoms may also be from non-allergic stimuli. With continued allergen exposure, people may notice that they also develop allergy symptoms from non-allergic causes such as cold air, fumes, perfumes, and so on. Allergic rhinitis, by the way, is not caused by food allergies. Symptoms of allergic rhinitis may be similar to those caused by non-allergic rhinitis or an upper respiratory tract infection such as colds and flu. However, allergic symptoms usually persist unless treated appropriately. Up to 50% of patients with allergic rhinitis also have asthma, and up to 80% of people with asthma may have rhinitis. The good news is that improved control of allergic rhinitis has been shown to give better asthma control in both adults and children. Complications of allergic rhinitis may include sleep disturbance or poor quality sleep, daytime tiredness, headaches, poor concentration, and worsening control of pre-existing asthma. The diagnosis of allergic rhinitis is generally based upon the symptoms described above and physical examination. Medical tests such as a blood test or skin prick test can confirm the diagnosis and identify the offending allergens. Treatment options available to manage allergic rhinitis include allergen avoidance techniques, medications including nasal medications such as simple saltwater rinses, nasal steroid sprays, and/or a combination of sprays, oral medications, and allergen-specific immunotherapy known as desensitization or immunotherapy. Traditionally, this treatment has only been available as a subcutaneous immunotherapy under the skin, and this involves regular injections. The good news is that certain causes of allergic rhinitis can now be treated with sublingual immunotherapy, or SLIT. SLIT can be used to treat grass allergies or house dust mites at this time. The above treatments are usually administered by a combined approach from your GP and pharmacist, your ENT, and/or your allergist. Thanks for watching. For more videos on ENT conditions, treatments and procedures, check out the rest of the videos on our YouTube channel or head over to our website for more details along with downloadable information sheets.